welcome to Explorations. Today we're talking with Arvind Singhal, who is the Samuel Shirley and Edna Holt Marston Professor and Director of the Social Justice Initiative at the University of Texas at El Paso. Over the past years, he has published and researched widely on the positive deviance approach to change, transformation, and innovation. In this first of a four-part interview, Arvind shares the story of how a chance meeting with Jerry Sternin completely transformed his thinking about how to best spread innovations. So let's get to it. Well, Arvind, I'm really glad to have this conversation with you. It's ever since I met you probably about 10 years ago, somewhere in that neighborhood. You have fascinated me, one, by your work, and just the topic of positive deviance has continually popped up in my conversations when I talk to people and they're bringing up a problem, and I'll say, do you know about positive deviance? And they don't invariably. And so I tell them the story. So if you could tell us a little bit about the story of positive deviance, and then and how your professional work has intersected with that, and how it has interested you in your academic research.
Well, thank you, Rick. It's such a pleasure to connect. And I have to say that the first time that I heard about positive deviance was in the year 2004. And just a little historical context, for about 20 years before that, mid-1980s to 2004, I was very interested in problem solving. And I was very interested in problem solving. And as you know, coming at it from the perspective of diffusion of innovations, looking at how new ideas and practices need to diffuse in a social system in order for change to happen. And one of our common intersecting interests, as you know, was the use of narratives, use of stories, use of melodramatic serials as a way of reaching more people and, sharing with them, showing them, maybe even telling them, what might be certain new behaviors related to whether it's HIV prevention or environmental conservation or, the status of women, you name it, and hoping that by being engaged in these narratives, they learn about new possibilities, they learn about innovations, and then sort of go along with it. So my perspective up until the time that I heard about positive deviance was bring in an idea from the outside, an idea that you think is good from your expertise, find a way to creatively narrate it, through characters and role modeling, and you hope that, there's some uptake. Well, in 2004, I'm at a conference invited by the Harvard School of Health Systems Improvement. And I think one of the reasons why I went is because, it had the Harvard letterhead, and they said they'd pay for me to come and attend. And I really had no official function there. And at the banquet, just before the conference began the next day, and this is the day, I remember this so distinctly, when a certain senator from Illinois, Barack Obama, gave the speech at the Democratic National Convention for John Kerry. And at this banquet, I was one of the last people to get into the room. There was only 2 chairs, 2 empty seats, and a corner table, which I found. I, of course, sat down, and then a minute later walked in a gentleman. Name is Jerry Sternin. And he said namaste to me. And I was surprised that, here's an Anglo-white man, and, he greets me in my own language, says a few words, and sits down. And he says, I'm Jerry Sternin. And who are you? And I tell him, and he says, do you have an official function at the conference? I said, no. He said, good. Then we can hang out together because I have none either. Now, the next day, Jerry gets a few improvised, impromptu minutes at this conference. I think he was like post-lunch, when people are coming in it's like, okay, we give the floor to Jerry for 5 minutes. And I think it was more like 10 or 15 minutes. And he talked about how they had used the positive deviance approach. It was the first time in my life that I'd heard about it, to address the issue of malnutrition in Vietnam. And not just, in terms of fixing a village or two, but at the national level. And I also learned soon that Jerry had won sort of, the Presidential Medal of Honor, or the equivalent of, in Vietnam, for his contributions to eradicating malnutrition. He and his wife's contributions. And what intrigued me about positive deviance was not just the terminology, although it's very oxymoronic, right? For those of us who are trained in sociology and, look at deviance as being necessarily a bad thing, something to avoid. Here was somebody who was talking about the positive outliers, those who in a given community, a vessel where you're trying to solve problems, have solved the problem. So that's the reason why they are positive, because they've solved the problem. And deviance in a statistical sense, and this really intrigued me, spoke to me, Rick, was because these are people who've solved the problem who shouldn't have. Mm. Now, I'd repeat it one more time. People in a system who have solved a problem who shouldn't have, meaning that they have solved the problem when they face the highest risk, they're the most vulnerable, and they are the least likely on account of being poor or on account of, other socio-demographic factors, which in a regression equation, which I was trained in, you would never expect. So, how would, for instance, as Jerry said, a poor, very poor family in rural Vietnam have their children who are well nourished? And that's the positively deviant question. And if you can find a few families, which they did in the first 4 communities, they're positive because they've solved the problem. They're deviants because they're not the norm. They've solved the problem. And if you can figure out what the heck they're doing, because they must be doing something, they don't have access to extra resources, then you begin with the premise that the solution to the problem, or the wisdom to solve the problem, is right here. You don't need to go outside. And that's very different from the way I was trained, that bring in protein bars, or, and so that, it was eye-opening for me. It allowed me to see the world in a way that I had not seen before. And, I was trained in looking at the problem, dissecting it. So you ask, what's the problem? What are you up against? What's not working? What are the deficits? What are the gaps? And then you put on your expert hat and then you say, okay, now I'm going to fix it. And here you're saying somebody has solved the problem and has solved it for a long time. It's just that we didn't know about them until we began looking for them. And you look for them by asking the question, are there some folks who shouldn't have solved the problem who have? And if you find them, then the premise is the wisdom to solve the problem is there. It just completely blew my mind. And that's the power of narratives, right? That you say, I didn't see the world this way. But here I can see that this makes sense. It's a very coherent, intuitive narrative of problem solving. And so I was hooked. Yeah. I walked up to Jerry Sternin. I said, Jerry, how can I be your apprentice? And I think by this time, Jerry had read the participant list. So even though I was not on the program, he said, I noticed that you are a full professor at Ohio University and a presidential research professor. You want to be my apprentice? Because that's, I walked up to him and I want to be your apprentice. I said, yes. And he said, well, I've come back after 30 years of serving as, Peace Corps director and as director of Save the Children in many countries to retire. And that for me was like, okay, Jerry, then I can have you. then you have all the time in the world for me. And he was very gracious. And it was at this meeting on the third day that Jerry invited anybody who was interested in exploring the idea of positive deviance to sort of an open session. And you can imagine I found myself there, and there were like 7 or 8 hospital CEOs, given that this was a meeting of the Harvard system of health improvement, health systems improvement. There were several CEOs, and lo and behold, a few months later, these CEOs, so intrigued by the notion of positive deviance as I was, asked Jerry if they could help them with the simple problem of hand washing. Because hospital-acquired infections, 1 million people, over 1 million people infected each year, and about 100,000 deaths. And these are technically what they seem like simple problems, but they're very complex. Yeah. And so Jerry was gracious enough. He invited me to Connecticut, Waterbury Hospital, where they're very interested in issues in looking at the problem of hand hygiene as well as medication reconciliation. Because, patients, when they come to hospitals and when they're discharged, often 60% of them don't follow the medication regimen. And that's a big problem because then they end up in hospitals and, of course, hospital-acquired infection. So it began with a focus on healthcare and, safety and clinical, you can say quality assurance. And Jerry was gracious to invite me into the fold. Then there was a project in Uganda and in Indonesia on child protection and sex trafficking and reintegration of child soldiers. I mean, talk about the complexity of problems. And he said, "You interested in going there and figuring out what is it that allows certain families in certain rural and remote areas of Indonesia not to send their daughters for, to the entertainment industry? Are you interested in figuring out why certain child soldiers who come back, who are abducted, so they're abductees and then, they're returned back to the community because they escape or they've been rescued, the difficulty for them to reintegrate themselves because they're sort of social pariahs. So all this to say, Rick, there's a long answer to your question, is that it turned my world upside down. It gave me a new way of looking at things. And I was always very interested, if you're interested in the diffusion of innovations, you are always asking the question, and also as an academic, how can I enhance my vision, right? And so, I've got glasses, and, what do glasses have? They have glass, and they have, they are side by side, and, it enhances my vision. I can see you a little more clearly. And, I've always been fascinated by a magnifying glass and Sherlock Holmes. I was always, intrigued by the notion of a microscope. I was very intrigued by the notion of a telescope. Instead of putting glasses side by side, you're lining them up together. And now you can see things that you can't see. And, you can see the moons orbiting Jupiter, as Galileo did, and you feel good. So positive deviance in a symbolic sense, it's not spectacles, it's not a telescope, it's not a microscope, but in a symbolic sense, it allowed me to see the world in a very different way. Yeah. And when you're looking at complexity, when you're looking at complex social problems, which you can't see, you need these symbolic narrative devices to help you.
Yeah, so, it's a different lens for sure. There's a woman I've worked with through the years, Nancy Klein, who's done a lot of work on thinking.
Yep.
And she has a saying is that the mind that contains the problem also can solve the problem. The idea is that we are actually more brilliant than we recognize. So we have assumptions, I think, about people who are poor, who have no resources, that they're not good problem solvers. And that's obviously a faulty assumption. They're very capable often of figuring out how to make things work for them.
Yeah, at least some of them, and
yeah.
And they may be few, but they may have solved the problem with no extra resources, and that's the key, right? Yeah, that they have solved the problem within their own socio-cultural context with no resources. And if they've solved it, and they've solved it for a long period of time, which they have, because they're positive deviants, it's, you know, we only discover the ones who have solved an existing problem. So the problem has been solved. There's no denying it, because the data shows that, you know, children in this household have been well nourished for a long time when they shouldn't have been. And given they have done it with their own resources and in their own socio-cultural context, by definition, by extension, you can say, by logic, you can say that if they've solved the problem in their own context with no extra resources, the solutions are accessible to all.
Mm-hmm. Mm-hmm.
And that is a beautiful story.